Hey guys, Steve Williams, surgeon in black here at Tri-Valley Plastic Surgery up in Northern California, and we do lots of interviews. Seriously, like lots of interviews. It just feels like we're doing interviews all the time, which is amazing. We're usually talking about plastic surgery trends or techniques or patient safety, which I love talking about. But this was an interesting one. Politico reached out to me, and I like Politico. I think that they do kind of bigger picture stuff. And we were talking about semaglutides, and I'm a huge fan of semaglutides because it really is changing the way people lose weight. It's the first drug that I think that really works, and it's all the rage. It's getting lots of uptake. But what I told Politico was, I think for plastic surgeons, for board-certified plastic surgeons, in some ways, these semaglutides might be a problem. And they said, well, that's crazy. What are you talking about? Because, of course, if people are losing weight, they're going to want more plastic surgery because sometimes a little bit of fat transfer to the face or to the hands, or maybe a breast augmentation or breast lift because they've lost volume, or maybe a tummy tuck. All those types of things, whether it's invasive or non-invasive, those are all plastic surgery things. And so like, you're insane. What are you talking about? This is great for plastic surgeons. And I said, well, look, you got to take it the next step further. These drugs really work, which means America is going to be less obese if they really take off the way that we all think they're going to. If America is less obese, it means that America is healthier, and that is a great thing. But it also means that America needs less doctors. That's the problem. Becoming a doctor in any specialty, whether it's OBGYN, orthopedics, internal medicine, it takes a long time. And when things change really quickly, like maybe in 2 or 3 years, you wind up with doctors that maybe the hospitals, the big healthcare companies, America in general doesn't need because people are healthier. And guess what? Those doctors don't say, hey, I'm just going to go home and watch daytime television. They say, I am still a doctor. I need to be able to take care of people. Some of those individuals are going to come into the plastic surgery space. And that's why plastic surgeons are always talking about practice creep and about making sure that people are going to board certified plastic surgeons, because we're the best at taking care of people. But we're a small specialty, and all it takes is 500 to 1,000 people to completely disrupt the practice of plastic surgery, because now all of a sudden you have that OBGYN or that orthopod who's saying, well, I got laid off and I'm not going to stay at home. I'm just going to open my own little med spa and I'll do some liposuction in the back. And I'm not really trained to do it, but I'm pretty sure I can talk people into it. Big problem. And it could be an issue for patient safety. It definitely could be an issue for plastic surgeons being able to take effective care of people. So we're spending a lot of time on that as a concept and thinking about it. And thanks to Politico for interviewing me about it and giving me a chance to talk about it. Check out the article. Thanks, guys.